Hi everyone, welcome to Quick Learn. In today's session, we are going to discuss on two different ways of monitoring blood pressure. Okay, without a further ado, let's get started. Most of us know that the commonest way of measuring blood pressure is by using a BP cuff, which is known as non-invasive blood pressure measurement. The pressure is obtained by using a manual or automated spike manometer. It is called non-invasive because no instruments are introduced into the body. Automated device measures the blood pressure. The pressure is displayed continuously, but the measurement is intermittent. Moving on to the invasive arterial blood pressure monitoring. An artery line is a catheter that is inserted into an artery, most commonly the radial artery. The other end of the catheter is attached to a fluid-filled system of pressure tubing. A mechanical signal created by the pressure inside the tubing is converted into an electrical signal by a transducer, which displays the signal as a waveform on the monitor. An arterial line provides an accurate and continuous blood pressure measurement. Furthermore, while measuring the arterial blood pressure, knowledge about labeling and zeroing are essential for accurate reading. The transducer should be relabeled every time the patient is moved, and the transducer should be zeroed at least once per shift. One who is giving care to the patient in ICU with invasive arterial line should be able to differentiate between the normal and troubleshooting arterial line waveform. So let's see what is normal arterial waveform. The arterial waveform represents the cardiac cycle. The waveform starts with a sharp rise known as the ascending limb or anacrotic rise. This represents the rapid ejaculation of blood into the aorta following the opening of the aortic valve. The peak on this rise represents maximum ventricular pressure called peak systolic pressure. This is followed by a downward slope known as decrotic limb or decreasing limb, which represents the decline in pressure during diastole. The decrotic notch represents the closure of the aortic valve. Now let's see arterial line troubleshooting. In troubleshooting, there are two different waveforms needed to be identified by a healthcare provider: overdamping or underdamping waveform. Overdamping of the pressure waveform occurs when there is blockage between the fluid-filled system and the transducer, such as a blood clot or air bubble. Underdamping can occur when the tubing is too long or the heart rate of the patient is too high. As invasive blood pressure monitoring gives healthcare provider the correct reading, it does have some complication. A patient having arterial line may suffer from infection, hemorrhage, interruption to peripheral circulation, and arterial line disconnection. So, as far as we have known about non-invasive and invasive blood pressure measurement, now let's see some steps to care arterial line, because negligence in care can lead to complications. While giving arterial line care, the set should be flushed with 0.9% normal saline. Glucose-containing solution should not be used during flushing. And the other arterial line care are: keep the transducer bag pressure inflated to 300 mmHg, observe the incision site for sign of bleeding or infection, dress the incision site with a sterile dressing, use an aseptic technique for connection or disconnection of new pressure tubing, check the blood circulation of limbs. Arterial line incision and removal is an aseptic procedure. And lastly, never give any drugs via an arterial line. Thank you for watching our video. If you find our video useful, don't forget to hit that like and subscribe button and share among friends. Thank you.